Gross undercuts are blocked out using wax and it is carved back flush to the bar. SG yellow matrices must be aligned parallel to each other for a uniform path of insertion and removal. Apply a very thin coat of separating medium, such as petroleum grease. Plast is applied onto the bar, the SG yellow matrices, and the relief wax. Plast will not adhere to the yellow matrices. A uniform layer of plast is applied all around the implant bar and the attachment components. It should be allowed to set for 10 to 15 minutes before attempting to lift off. Begin to pry the plast pattern slowly to allow air to enter underneath. Apply pressure from the different areas to ensure an even liftoff. Remove any pieces of the relief wax left inside and inspect for good adaptation. The easiest way to remove the SG yellow matrices is to melt them using a wax knife with a fine tip, then remove using a pair of tweezers or hemostat. Inspect for accurate adaptation of the SG yellow matrices. Check the overall thickness of the pattern and begin to adjust it to measure at least 0.3 millimeters in the most prominent areas. We recommend for mechanical retention the use of square mesh pattern turned flat side up. This will make each individual square a retentive undercut. If space permits, retentive tails must be added to the overcasting for distal support of acrylic flanges and saddles. These can be made using any type of retention pattern such as oval ring patterns or thin gauge sprue wax wire. In this method, spruing is done in a crown and bridge style. However, in this case it has been sprued for induction casting. Invest, burn out, and cast using conventional methods. Inspect framework for any casting defects and cut off sprues. Remove any bubbles or casting defects using suitable burrs or stones. Take care only to remove the defects, not to grind indiscriminately. Place the framework gently over the bar to determine how much adjusting will be necessary. Apply a thin coat of colloidal graphite to the implant bar, as this will help in determining the pre-contact areas inside the overcasting. After applying the colloidal graphite to the bar, place the overcasting gently over it, and remove the black marks inside the overcasting using a suitable burr or stone. Once the overcasting has been properly fitted, it should have a snug and positive fit over the implant bar.